You don't need a gym membership or intense workouts. Just 30 minutes of brisk walking 5 times a week can help lower your cancer risk. It's been shown in multiple studies that although we aim to get a step count of around 10,000 steps a day, however, even a step count of anywhere between 2,800 to 8,800 can significantly reduce your mortality risk from various different causes. Cancer can often feel like something completely beyond our control. But did you know that nearly 4 in 10 cancers are linked to lifestyle choices we make every day? Hi, I'm Dr. Neema Bhat at Therrapie Healthcare and I'm a hematologist. Today, I'll walk you through 7 key lifestyle-related factors that can increase your cancer risk. And more importantly, what you can do to reduce this risk. Let's begin with tobacco. Tobacco use remains the leading preventable cause of cancer worldwide. It is responsible for a wide range of cancers, not just lung, but also mouth and throat cancers, esophageal and stomach cancers, bladder, pancreas, kidney, cervical cancers, and this is due to the carcinogenic chemical in tobacco that damages the DNA in your cells. Over time, this damage can cause cells to grow uncontrollably. It's important to note that chewing tobacco, gutka, pan masala, and snuff are equally harmful. Quitting tobacco at any stage brings immediate benefits and dramatically reduces your cancer risk over time. Now let's talk about food and weight. A diet high in red meats, processed foods, sugars, and saturated fats, and low in fiber and whole grains can contribute to chronic inflammation, hormone imbalances, and insulin resistance, all of which are known pathways to be responsible for cancer. Research shows that strong links between poor diet and colorectal cancer, liver, pancreatic cancer, breast cancer, especially seen in women after menopause, are all commonly associated with poor diet and heavier weight. Also seen in women are endometrial and kidney cancers in both men and women. Excess body fat also increases levels of estrogen and other hormones that may promote tumor growth. Making sustainable dietary changes such as taking more fruits, vegetables, legumes, more whole grains, while at the same time reducing processed foods can significantly lower your risk for cancer. This is not about restriction, it's about building metabolic health and reducing inflammation. Remember, food is like building blocks for our cells. So it's important to be aware of what you're putting into your body so that these building blocks are healthy and robust. Cause number 3, alcohol. Medical evidence has clearly shown that even light to moderate alcohol intake can increase cancer risk, especially when it's combined with other risk factors. Alcohol is metabolized into acetaldehyde, which is a toxic compound and that damages DNA and impairs the body's ability to repair cell damage. Alcohol use has been linked to several cancers including breast cancer, liver cancer, colorectal cancer, esophageal and oral cancers. There's no completely safe threshold for alcohol consumption. Reducing alcohol consumption or avoiding it altogether can meaningfully lower your risk, particularly if you have a family history of cancers and other lifestyle-related risk factors. Physical inactivity. This may be a silent risk factor, but movement and the lack of it is extremely important as well when it comes to a modifiable risk factor. A sedentary lifestyle does not just affect your weight, it also plays a deeper role in increasing your risk for certain cancers, particularly colon cancer, breast cancer, especially in women after menopause, endometrial or uterine cancer, also seen in women. When you remain inactive for long periods, it can lead to hormonal imbalances, a weakened immune system, and chronic low-grade inflammation, all of which create perfect conditions in the body that might actually breed or allow cancer cells to grow more easily. The good news is even small amounts of movement on a daily basis can make a huge difference. You don't need a gym membership or intense workouts. Just 30 minutes of brisk walking 5 times a week can help lower your cancer risk. It's been shown in multiple studies that although we aim to get a step count of around 10,000 steps a day, however, even a step count of anywhere between 2,800 to 8,800 can significantly reduce your mortality risk from various different causes. Let's talk about something many people are not really aware of: infections that can increase your risk of cancer. Certain viruses and bacteria can cause long-term and chronic inflammation in the body, which over time may lead to cancer. Some of the most common viruses or infections include HPV or human papillomavirus. This is strongly linked to cervical cancer and also associated with anal, throat, and some oral cancers. Hepatitis B and hepatitis C both increase the risk of liver disease and hence liver cancer. Helicobacter pylori, common commonly known as H. pylori. It's a bacterial infection that usually affects the stomach, can increase the risk of stomach cancer. What's important to know is that many of these infections are preventable and also treatable if it is picked up at the right time. For example, the HPV vaccine, ideally given during adolescence and younger reproductive years, can protect against several high-risk cervical cancers later in life. The hepatitis B vaccine is also now part of routine childhood immunization and offers long-term protection against infection from hepatitis B and in turn liver cancer. Testing and treatment for H. pylori at the right time with symptoms of gastritis can significantly reduce the risk of gastric cancer, especially in regions where this infection is common, one of those regions being India. Infection-related cancers are more likely to affect people in their 30s, 40s, and 50s. So early awareness of symptoms that come with these infections and preventive strategies can make a lasting difference. These aren't just medical facts, they're opportunities that general public can act on before cancer begins. Another area we often underestimate and is known that exposure to carcinogens in the environment or workplace can also lead to cancer. Long-term exposure to substances like asbestos for people who are working in factories, arsenic, which is sometimes seen in drinking water if it is not purified or treated the right way, industrial chemicals, diesel exhaust can increase the risk for lung, bladder, skin, and other cancers. If you work in a high-risk environment or live near industrial zones, it's important to use protective equipment, reduce exposure whenever possible, and undergo regular health screenings so that these cancers can be picked up at the earliest. Clean air, clean water, and safe working conditions are not luxuries. They are the basic key pillars of cancer prevention. Finally, let's talk about stress and why it matters. Like our poor diet and lack of physical activity, chronic stress contributes to inflammation, hormonal imbalance, and weakened immune system or immune functions, all of which can increase cancer risk over time. Sleep plays a key role too. Poor or irregular sleep affects the body's ability to repair cells and regulate hormones. What helps? Most importantly, a regular sleep routine. Mindfulness or meditation and reduction of stress is also hugely helpful. Staying physically active can play an important role in keeping your immune system robust and active. Strong social support so that, again, stress can be relieved and inflammation can be reduced. Cancer prevention isn't just physical, emotional health matters too. At Therrapie Healthcare, we believe cancer prevention is not a one-time screening. It's an ongoing process and a huge commitment for your health. We help through risk assessment based on lifestyle, genetics, and family history, preventive screenings including blood work, imaging, and biopsy if indicated based on the screening tests, lifestyle guidance for those at higher risk, education, counseling, and emotional support. You don't need to wait for a symptom to act. If you're looking to understand your risk or take steps toward healthier habits, we are here with science, support, and clarity. Do share this video with someone who might benefit and subscribe for more cancer prevention insights from Therrapie.